Play on our own. Alright, so I guess we'll go ahead and get started with today's lecture. Unfortunately, I'm starting to get sick, so I found myself zoning kind of in and out all day today, so if I kind of zone out for a little while during the middle of the lecture, hopefully it won't happen, but just bear with me. Today's lecture is not going to relate at all to what we're doing in lab. Today we're going to be finishing up neck, but we've already covered all of the neck structures in previous lectures. So we'll finish up the neck in lab today, and then this stuff will be relevant to what we do in lab Friday as well as Monday. All right, so outline, today we're going to be talking primarily about the muscles of facial expression. So we'll go over what muscles of facial expression are, what they do, what their innervation is, and then we'll go through each of the muscles in detail, what action it performs, and what nerve innervates it. Then we'll go over the sensory innervation of the face, and we'll finish by looking at the blood supply to and drainage from facial structures. All right. So, as some of you may have figured out by this point, the muscles of facial expression are in fact responsible for facial expressions. So they're accurately named. All of them are supplied by the facial nerve, or cranial nerve 7. They originate from either bones or fascia within the face, and all of them insert into superficial fascia beneath the skin. So unlike most of the other muscles that we've looked at, when these muscles contract, they're not going to be moving another skeletal element. They're going to be moving soft tissue in relation to themselves. All right. So here is a Netter's drawing of what the muscles of facial expression look like. As with most Netter's drawings, it's a little bit unrealistic and a little bit on the optimistic side. So when you get around to skinning your face on Friday and Monday, you're probably not going to see all these huge, really, I guess, sort of ripped facial muscles. They're really thin. They're really easy to remove while you're skinning the face. If you can find a reasonable proportion of them, you've done a really good job. All of these muscles, as I said, are very small. A lot of them are overlapping with one another. So we're going to talk about a bunch in the lecture today that you're not actually going to see in dissection because they lie beneath other ones. But they all insert into the skin or the fascia right below the skin, and the skin is very pliable on the face. So notice you can move your face around. The skin on your head shifts around quite a bit. So when we flex these muscles, we can make a lot of different facial expressions. So certain people have really excellent command over this, and you can make a variety of different facial expressions. Some people can flex individual muscles, but in general, if you don't really practice this, you just sort of react and you make various facial expressions. So I'm not a huge Jim Carrey fan, at least not since I exceeded the age of 12, but he's really good at making a lot of different facial expressions. So early on in his career was known as Rubber Face, which I'm sure this is board. But he can do all sorts of really weird things. So this is a little clip of him just flexing individual muscles here. So you can watch different parts of his face move around, but in addition to moving the various parts of the face, muscles of facial expression are also attached to the scalp. So if you watch, his hair sort of shifts back and forth, as well as his ears shift anteriorly, posteriorly, and up and down. So muscles of facial expression also move the ears, as well as moving the scalp around. Okay, so onto the innervation. In broad scopes, this is very simplistic. All of the muscles of facial expression are innervated by the facial nerve, so cranial nerve 7. But keep in mind that the facial nerve does a whole bunch of other things besides innervate these muscles of facial expression, enough so that we're going to spend an entire lecture talking about the other things that the facial nerve does next week, I believe. But the part of the facial nerve that we're going to be worried with today is going to exit out of the skull at the stylomastoid foramen that everyone should remember from the skull quiz. I think that was maybe on the practical. Once it exits out of the stylomastoid foramen, it sort of splays out in all directions. One of the branches is going to go immediately posteriorly. The rest of them are going to dive into this large salivary gland on the side of the face called the parotid gland. In here, it's going to form sort of a loop that will send branches all over the anterior part of the face. So we have another loop of nerves here, and this is called ansa facialis. So this is similar to ansa cervicalis that we saw before, except ansa facialis would be the roof of the face. And there's a bunch of other names for this as well. This kind of looks like apparently a moose's foot, so this is sometimes called the pes anserinus of the facial nerve. It's also called the parotid plexus because all of these nerves are coming out of the parotid gland. Okay, so we have 6 different named branches here that we'll go through. Shown in orange are the temporal branches. In red are the zygomatic. Black is buccal. Purple is mandibular, or sometimes called marginal mandibular. In blue is cervical. And in, I guess that's brown in the back, is the posterior auricular. So throughout the class, I'm just going to call these cervical, mandibular, buccal, whatever, but keep in mind that these are called cervical branch of the facial nerve or buccal branch of the facial nerve. And this is important because sometimes there are other nerves with these names. So there's a buccal branch of the facial nerve, but there's also a buccal nerve, which comes from a different cranial nerve. So keep in mind these are branches of the facial nerve. So a mnemonic to keep these in order and to keep them straight. To Zanzibar by motor car. And so this is for the 5 branches of the ansa facialis. So these 5 here. The posterior auricular isn't actually part of ansa facialis. It jumps off of the facial nerve right as it exits the foramen. But we can add this in here by adding a please. So to Zanzibar by motor car, please. And this will tell you the order going from sort of anterior superiorly and then around Italy. It's kind of a nonsensical one, not that your mnemonics usually mean anything. But does anyone know where or what Zanzibar is?
Tanzania.
Tanzania. And what is it? It's an island. So it's an island off the coast of Tanzania. So we have some geography buffs in here. So you're not really going to drive to Zanzibar, even if you are in Tanzania. But I guess they wanted some place that started with a Z. So to Zanzibar by motor car, please. Okay, on to the muscles themselves. So here's our idealized face again. And real big, right up in the front, sitting over the frontal bone, we have a muscle called frontalis. And frontalis is actually part of a 2-part muscle called occipitofrontalis. The 2 parts of this muscle are going to be attached to a big aponeurosis that sits on the top of the skull called the gala aponeurotica, or the epicranial aponeurosis. In the front, we have frontalis, and in the back, we have occipitalis. So for each of these muscles, the N means which branch the facial nerve is going to innervate it, and the A is the action. So when you contract your frontalis muscle, that acts to raise the eyebrows up. You contract your occipitalis muscle, that will pull the scalp backwards. So here's an example of someone contracting their frontalis. This is very characteristic. You get these sort of transverse wrinkles in the forehead when you flex this one. Frontalis actually has 2 separate muscle bodies. So some people can flex one relative to the other. And this gives you the ability to raise one eyebrow relative together, or the people's eyebrow. For any WWE fans. Okay, another muscle that acts on the brow is called the corrugator supercilii. This one's also innervated by the temporal branch. And this one sort of acts transversely to wrinkle the skin between the eyes. So here's an example of this one. So this one also has a characteristic fold, and you get these vertical folds in between the eyes. There's another sort of pyramidal shape or triangular shaped muscle up here called procerus, innervated by the buccal branch, weirdly enough. And this one is going to sort of pull down the forehead or depress the eyebrows. So here's an example of that. So this sort of drags the eyebrows down, giving the classical angry eyes look, or in this case, a confused expression. Okay, next we have a ring of muscle that surrounds the eye. This is called orbicularis oculi, and this has 2 separate parts. The orbital part, which surrounds the eye, and the palpebral part, which lies on the eyelids. They're both innervated by temporal and zygomatic branches, And they're both going to act to close the eye, but the palpebral part is going to be active in normal closure of the eye, so like when you blink or just passively close your eyes. The orbital part is a little bit farther out, and that's going to be active when you forcefully close the eye. So if you close really hard, you kind of pull the skin around the eye over the orbit, and this will be sort of a protective measure to protect your eye. And these muscles are going to insert or originate from a little piece of connective tissue in the medial part of the eye called the medial palpebral ligament that we'll talk about more when we actually talk about the orbit itself. And here's an example of someone using just the palpebral part of orbicularis oculi on one eye. Another two-part muscle, nasalis, has a transverse part that's going to attach onto the bridge of the nose, and an alar part that's going to attach on the outside of the nostril through the alar cartilage. Both of them are innervated by the buccal branch, but they do slightly different things. So the alar part is going to flare the nostrils, and the transverse part is going to crinkle up the nose. So here's Marky Mark using the alar part of his nasalis muscle, and maybe crinkling the nose with the transverse part.
These pictures are really helpful.
Good. I'm not good enough to flex these muscles independently, otherwise this would probably be a more entertaining way. Okay, next we have orbicularis oris, another one innervated by the buccal branch. And the action of this one is to close off the oral cavity. So this is another orbicularis muscle, but unlike orbicularis oculi, this isn't a real sphincter. It's a complex intermingling of fibers surrounding the oral cavity. But this is going to close the entrance to the oral cavity or sort of pucker the lips. All right, now we have a whole series of muscles that attach to different areas around the mouth. Obviously, the mouth is very much used in facial expressions, so there's a lot of different combinations of muscles that can pull it in different ways. So our first one is called zygomaticus major. This is coming off the zygomatic bone and inserting near the angle of the mouth. And this one's going to act to pull the corner of the mouth posterior-superiorly. So this is sort of a classic smiling muscle. Sometimes this muscle is what we call bifid. Don't remember what bifid means? But for instance, sometimes this muscle will split into two. And one of the parts of the muscle will extend a little bit farther down. And part of that bundle will actually insert into the skin. So people who have bifid zygomaticus majors end up with dimples. So when it pulls on the skin, it pulls that skin in, and we get a dimple formed. So how many of you have bifid zygomaticus majors? Anyone? I do not. No one has dimples? No. You don't have to demonstrate. All right, just medial to zygomaticus major, we have zygomaticus minor. And this is going to also insert more medially on the upper lip. So this will pull the upper lip posterior-superiorly, so not the corner of the mouth, but the upper lip. This is another one that's active during smiling. So if you see smiles that sort of, maybe you see a little more gum than usual, maybe they're activating their zygomaticus major a little more. Minor. Okay, inserting into the corners of the mouth and running transversely is a muscle called rhizorius. And this is going to pull the corner of the mouth laterally. So this one is also known as the fake smile muscle. So rather than actually lifting the corners, you just pull them laterally and show a lot of teeth. But so rhizorius just pulls laterally, not superiorly. All right, a deeper layer of muscle that's also going to act on the angle of the mouth is levator anguli oris. So you'll notice a lot of these muscles, their names tell you what they do. So levator, you guys probably remember from levator scapulae. Levator means elevate. Anguli oris means the angle of the mouth. So this is the elevator of the angle of the mouth. So here's an example of someone activating that. And this is another common smiling muscle. So all of these muscles that insert into the corner of the mouth are going to help you with smiling. This is the only picture of you I'm on.
But I'm smiling.
That is
usual.
works. Okay, a little bit more medially and originating just under the orbit, we have levator labii superioris. So again, the elevator of the upper lip. And this is going to pull the upper lip superiorly. An example of someone utilizing levator labii superioris, but not any of the more lateral levators. Awful lot like this in both action and hair color and style. Okay, we have another elevator of the upper lip that qualifies as the longest named muscle in the body, called levator labii superioris obliqui nasi. So this is going to elevate the upper lip, but it also inserts a little bit onto the edge of the nostrils here, so it'll lift up the nose a bit. The main action, though, is to pull the upper lip superiorly, and it has a really long name, so this is also referred to as the Elvis muscle. So this is what he used to just raise the upper lip on one side. And apparently this is popular for singers, but I'm wondering how much I'm dating myself here. Does anyone know who this is? Billy Idol? What was the guess? Billy Idol is like a late 70s or early 80s sort of punk guy. He's got a little bit more weird of a lip. Alright, attaching into the corner of the mouth from below, or so we'll depress the angle of the mouth, is depressor anguli oris. So this will be sort of a frowny face one, so you're pulling the corners of the lips down, you're really sort of upset. And again, this is one you can do on just one side only if you only want to pull a single side down. After I had done this, I read up a little bit more about Sylvester Stallone, and apparently this isn't him probably activating one side. He actually has a palsy in his face caused from when he was born. They pulled him out with forceps and damaged some of the nerves on one side of his face. So that's kind of like slurs when he talks. Nerve damage, but anyways, that's the action that he would do. Alright, the depressor of the lower lip, or depressor labii inferioris, is just medial to that.